I'm Tom Luescher, and today I'm delighted to talk about an old drug with a new indication, and it's colchicine. And as you can see here on the first slide, colchicine has been used for decades, if not for centuries, as a product of the autumn narcissus to treat gout, to treat inflammation, particularly that you see here on the toe with the crystals in the joint. And for many years we didn't know really how it works, but recently basic science has elucidated all the mechanisms that are involved in the action of colchicine. And as you can see in the next slide, colchicine interferes with the polymerization of tubulin A and B, and therefore with many cellular pathways that are relevant for inflammation. More specifically, it inhibits the inflammasome that you can see here on the top of the slide. And interestingly, the inflammasome is activated by crystals. You know that it is activated by cholesterol crystals, but now we learned it's also activated by urate crystals. And what is colchicine for? It lowers also urate, it inhibits inflammation, and it works through the inflammasome. And eventually, the inflammasome, as we learned from the CONTOS trial, is very, very important also for coronary artery disease. And you can see here how it interferes with atherosclerotic plaque formation, and of course inflammation begets coagulation and therefore vascular occlusion. And there are two trials that we can quickly look at, the COLCOT trial and the low-dose colchicine trial. They both used 150 milligrams of colchicine to treat patients with coronary artery disease, and they reduced interventions and myocardial infarction. Not deaths on its own, but maybe there is an issue with that, because they treated any patient with coronary disease or with an acute coronary syndrome. What we probably should do, as we shown earlier by basic science investigations of coronary inflammasome, that in fact some patients have infarctions with inflammations, others without. And therefore I think we should now look at those with CRP to see whether these are really the patients that most benefit from colchicine. And it's a cheap drug, it lowers infarction, and maybe in this subpopulation even deaths. So the future is on with an old drug with a new indication. Thank you for attending.